Hello, and thank you for joining us today for this joint webinar from PwC and Workday on the Affordable Care Act employer reporting. For those of you in the Twitter sphere, you can join the conversation. Join us at PwC Advisory or hashtag WDAY or at Workday. I'd like to take a moment to introduce our speakers today. From PwC, we have Charlie Ovino, and Charlie is a principal in Human Resource Services. He leads global HR services and is a national resource for HR and benefit plan governance, risk management, and compliance. I'm Christina Gold. I'm the Vice President of HCM Product Strategy at Workday. And also joining us today is Marlene Schultz, Workday Product Marketing Manager, and Marlene will be showing us the Workday product in action. So let's get started. To give you an idea of where we're going today, I'd like to just share the agenda with you. We're going to start with a brief overview of why we're doing this session today, and then we'll share how the Workday and PwC relationship can help address this current and pressing situation. PwC will share the common challenges and decisions that we see with ACA reporting, and then you'll see the Workday solution in action. PwC will also share their strategy to execution, and we'll wrap up and open it up for any questions at the end. The Federal Patient Protection and Affordable Care Act, commonly known as Affordable Care Act or ACA, has resulted in a number of benefits and responsibilities since it became legislation in 2010. This year, the reporting requirements for employers takes effect. So effective calendar year 2015, if you offered health insurance or provided self-funded health coverage, you must file an annual return in 2016. Think of this process very much like you would think of your Form W-2 and Form 1099 processes, those that you might be very familiar with. There's been a lot of anxiety around this whole reporting requirement and really a lot of information which really has caused some confusion about which sources to use, how to comply with the requirements as they exist. The focus of this webinar is to share the Workday and PwC solution and expertise in this area to help you navigate this latest requirement. Before we dive in, I'd like to share a bit more about the Workday and PwC relationship. Workday provides a human capital management solution that seamlessly combines benefits with all the actions, really with all the pieces working within your HCM solution. So it provides a reporting foundation that enables our customers to bring together all the information really required to meet the ACA reporting requirements. And PwC has been a partner of Workday's for over 7 years now, and they actively participate in the Workday services ecosystem. They were our first partner to serve on the Workday Delivery Assurance team and have continued to grow their practice organically over the last 7 years. They provide expertise in many different areas, including, of course, ACA, which is our topic of discussion today. And with over 250 consultants in their Workday practice, they really are able to bring not just the expertise in the specific area of ACA, but the expertise in Workday. So the combined partnership of, we feel that the combined partnership of PwC and Workday really allows for a very comprehensive solution that can guide you through the ACA reporting requirements. So with that, I'm going to turn you over to Charlie to talk about the challenges that people are facing with these new requirements.
Christina, thank you very much for the kind introduction, and greetings to everybody from Atlanta, which is definitely Hotlanta today. We've been hearing a lot about ACA for a number of years now. It's not necessarily new to anybody's vocabulary, and HR departments have typically been working to comply with the laws and the new rules that are out there, generally by modifying their plan designs. The reporting requirement, however, that we're going to be talking about today is really a new phase of the law, and it starts to get more into the enforcement that's going to be out there. So it's something that employers to date haven't encountered. I'd like to just spend a few minutes before kind of jumping into some of the challenges that we have on just giving a little bit of background about the reporting requirements that will give some history about why we're doing what we're doing for those of you who are getting up to speed on this a little bit. And I want to give a very, very brief caveat also. The rules related to this area, as you would suspect, are very, very detailed, and I will by necessity be generalizing and summarizing a lot of the information. So, you should look definitely at the rules in detail against your particular facts before making any final determinations about, especially the technical requirements that happen to be out there. So just a little bit of an overview again for folks who aren't as aware with the ACA reporting requirements and the penalty regime that happens to be out there. ACA imposes severe penalties for employers who do not provide coverage for 70% of their full-time employees, which means those who are working at least 30 hours. How severe are the penalties? It's basically if you fail that, it's going to be $2,000 per individual times the number of full-time employees that are working for you minus 30. So just a quick example, if in 2015 you have a company that covered only 69% of its employees and it had 1,030 employees, the penalty would basically be the 1,000 employees, the 1,030 minus the 30, so 1,000 employees times $2,000 or $2 million. So it's obviously a very, very steep penalty that's out there just on the coverage requirement. Also, that 70% threshold that you're applying for 2015 will rise next year in 2016 to 95% threshold. So you'll have to cover no longer 70%, you'll have to go up to 95. The ACA also imposes penalties where the coverage an employer provides is not affordable, and the cost of the individuals receiving the subsidies through the public exchanges, that cost, which is significant, is funded by these penalties. So the government needs a mechanism to identify where employers are out of compliance. And I believe that the current federal budget was including, in anticipation of these penalties, an amount somewhere around $6 or $8 billion that would be collected. So there is an expectation that employers will not, in many cases, be meeting either the coverage or the affordability requirements, and that they will indeed be paying penalties. So what this means, basically, is to collect these penalties, the government is going to require an extensive amount of new information that has not been collected previously. So let's discuss the information. Let's discuss the information that we have. And I think we're just jumping around a little bit. There we go. So let's look at what clients are facing. And the first thing is trying to identify the full-time employees that are out there for ACA rules. I mentioned above that the employers need to cover 70% or 95% next year of its full-time employees. But full-time is not necessarily going to be intuitive or something that's currently being captured by employers. And the IRS spends dozens of pages basically explaining what would otherwise one would think be a simple concept. The basic rule, however, is that a full-time employee is an employee who, for any month, is going to be employed on average at least 30 hours per week or 130 hours per month. So what goes into the hours collection? And hours can include hours worked, but it'll also include hours where an employee is paid but does not work, such as vacation, illness, can include military duty, or leaves of absence. And sometimes the data for some of those buckets of hours will reside on a different system. For example, leave data can very often reside outside of one's core system, which will add to the complexity. As an alternative to tracking actual hours, the IRS has provided for a method to make the determination by looking back at a period of 3 months up to 12 months to see if the hours worked, to see the hours worked, and use that information on a go-forward basis. This can be advantageous and simplify the reporting, but it can also, in a lot of cases, add to the overall complexity. For example, these look-back periods, when you're kind of looking back to determine the hours that an individual might have worked historically, they can differ in the duration and when they begin, kind of the measurement period for collectively bargained employees. They can be different for salaried and hourly employees. They can be different for employees in different entities. And they can also differ for employees in different states. So there's a whole variety and array of possible collection periods that are out there. In addition, for employees that have seasonal, for companies that have seasonal employees like retail and hospitality, or companies that have variable hour employees, the determination will be very important, and in some cases, one of the alternate or optional methods that I talked about will be very helpful for the employers. Last but not least, for identifying the full-time employees is the issue of identifying common law employees, or individuals like independent contractors that the IRS might come in and reclassify as a common law employee, and by doing that, force them to be included in the ACA test. Not necessarily the biggest concern for 2015 when you're looking at a 70% threshold, but when we get into 2016 and later years, when you're dealing with a 95% coverage threshold, the movement of independent contractors can have catastrophic effects. So what are some of the challenges? What challenges relate to gathering and aggregating the data, the item number 2 on the slide? A lot of people would describe the reporting for ACA as something similar to W-2 reporting. And while it is a report that you're generating and sending to the IRS, there are some really key differences. So W-2 basically resides in one location, in payroll. But the information for ACA reporting, which is going to go on to 2 forms filed with the IRS, a 1094-C and a 1095-C, that information can reside on multiple systems. And let me just give a couple of examples to highlight the complexity that's related to the data and the data collection here. So just the employee demographic data, the names, social security numbers, compensation, that can be in payroll. It can also be in HRIS. The hours, which are important to capture to measure that 30 or 130 hour cutoff, they may be in a timekeeping system, they could be in payroll, they could be in HRIS, and you may have to reach out into a separate system for leave data and try and bring that in. And some employers will actually have some of their leaves handled by a third party, so you'd have to go out and access that information from a third party system. Health coverage may be in payroll, or it could very likely be in a third-party system like your health plan administrator, especially where employers have programs where you may have multiple different types of coverage, which with the same pay rate, looking at payroll won't necessarily tell you the type of coverage that an employee has elected. Another area is the reporting is also going to apply to dependents that are covered on the health program. And very often dependent information is not in any system, and it might, the best source for that again might be the health plan administrator. There are a lot of companies that have like dependent names, but very frequently they won't have social security numbers. Also, there's going to be groups of individuals that may no longer be employees, but for whom you're going to have to be reporting on because they're still providing some type of health benefit. Examples of that are going to be ex-employees who are on COBRA or retirees. And again, very frequently you'll have COBRA administration being outsourced, and sometimes post-employment benefits, retiree medical, is something that could also be outsourced or done by a third party. Number 3, in addition to possibly not having Social Security numbers for dependents, there's added complexity related to Social Security numbers. Namely, if you need to pull information from various sources, as I mentioned, like HRIS, payroll, third-party systems, COBRA administration systems, and so on, there's inevitably going to be situations where you're going to have inconsistent, incomplete, overlapping, or duplicative Social Security numbers. So trying to make sure that that number is cleaned up and remediated in and of itself can be a pretty significant burden and challenge. As if there hasn't been enough administrative burden kind of that I talked about already, there are some additional ones that I wanted to highlight. The expectation is that when employees receive this new form, the 1095-C, which they've never gotten before, it will raise questions and they're going to begin calling the HR department or their service provider or call center. So some change management will be important to both educate the employees, try and reduce the volume of the calls, and also have a system or a process in place to handle the calls that do come in. Also, just the volume of the forms, number 5, that will need to be produced for some employers will be a challenge. Now, they can be generated and mailed with the Form W-2, so they could go in the same envelope, for example. But many employers are seeing challenges in getting this done in time, at least for the first year, and doing a joint mailing. So there will be the logistics of trying to get all of these forms pulled together and mailed out in time. So let's recap here on some of the data elements that we're basically going through. First is identifying of ACA common law and full-time employees, and we've talked about that. There are just tremendous issues related with trying to get clarity around those areas. The second area, the type of coverage offered. And I have a couple of terms here, very, very high level. Minimum value, will mean that the plan, not the employee, is paying at least 60% of the actuarial value of the benefits. So it's something that most employers haven't necessarily been looking into in the past. Next is minimum essential coverage, and that means that the plan needs to provide certain levels of essential coverage, and by and large, larger employers, the government exchanges, Medicare plans, basically they're all currently meeting those standards. And then the last is knowing the type of coverage that's provided. You not only need to report that coverage was provided, but you're going to have to report on the forms the type of coverage. Was it self? Was it family? Was it self plus spouse? And so on. The next item deals with employee contributions for the lowest cost plan, which means it'll have to be less than 9.5% of the employee's family income. And generally, the employee's W-2 can be paid, and I'm going to talk in a minute just about that concept. So when we're talking about affordability, and that an employer-sponsored plan needs to basically not exceed 9.5% of the employee's household income, you usually are confronted with the situation that employers do not know their employees' household income. So the regulations have provided a couple of safe harbors related to this, again, just to add to the complexity. And the first is, as I mentioned, the W-2 safe harbor. And that can be used if the employer's lowest cost coverage for a self-only plan does not exceed 9.5% of the employee's W-2 wages. Now, the question is obviously, because you're having to do this on a month-by-month basis throughout the course of the year, is you usually don't know what the employee is going to have on their W-2 until the end of the year. So there's a little bit of risk obviously related to that approach. A second safe harbor looks at the employee's rate of pay. And usually it's going to be based on the rate of pay during the month, and that kind of is occurring more in tandem with when the employee is actually receiving their pay, so you don't have to wait to the end of the year to make that determination. And the third possible safe harbor that's out there is based on the federal poverty line. And this one usually ends up being, based on our experience, one of the more expensive options for employers. But basically you're looking at the cost to the employee for self-only coverage, and that can exceed 9.5% of the federal poverty level for a single individual based on their state of residence. So you're going to have to track it state by state. The next area dealing with the waiting periods, an ACA obviously allows a waiting period for up to 90 days, and there's also the look-back periods that you can be using and different periods that you'll have to track. As I mentioned before, you also need to know the types of coverage provided, know the employee independent Social Security numbers. For the 70 or the 95% test, you need to know full-time, who's full-time, and the total number of employees that you actually have. And then last but not least, you have to identify who your applicable large employer members are. And if you look at the diagram in the upper right-hand side of the page here, that illustrates the ALE, the applicable large employer concept. So each entity with a unique federal employer identification number will generally be an ALE. So it's breaking the information down that way, and then under each one of these entities, capturing the employees for that entity, and then having each entity do a separate filing. So what happens if you don't file on time? And there's going to be some penalties associated with that. It's a little bit hard to read, but the right-hand column of this table shows the penalty amounts for the forms that are required to be filed after December 31st, 2015. Very quickly, I'm going to do these in pairs. The first pair is you get a $250 penalty for failing to file, and that maxes out at $3 million. The next pair reflects that if you have a later corrected filing and it's fixed within 30 days of the filing due date, it's $50 per failure, up to a $500,000 penalty. And if you're a little bit later, for the next two, the penalty is $100 each if it's done before August 1st, with a maximum of $1.5 million. The last row there, which is $500 per filing potential penalty, is where there's some intentional disregarding of the filing requirements. Now, these penalties each apply to the ALE or to the each applicable large employer or each entity with an FEIN number, so they can grow even larger than this. So that essentially is a little bit of a framework for what the background is and what the challenges are related to doing the filings. And Christina, I'll hand it back over to you.
Thank you, Charlie. And I just want to remind the audience that you can, if there are any questions that you have, you can place them in the Q&A panel. So at this point, let's take a look at how you can support your ACA requirements with Workday. And Marlene Schultz, our Product Marketing Manager, will lead us through this demonstration. Marlene?
Good morning or good afternoon, everybody. My name is Marlene Schultz, and I'm a Product Marketing Manager here at Workday. And for our demonstration part of this session, we'll take a look at how Workday can help you master the complexities associated with managing the Affordable Care Act for your US-based employees. So we'll take a look at 3 features that we designed to help our customers meet the requirements of the Affordable Care Act. First, we'll take a look at the configurable ACA dashboard, where you will have visibility into your workforce's ACA eligibility. Next, we'll take a look at measurement periods and how you can automate enrollment. And finally, we'll see how you can configure Workday to meet your organization needs in terms of the required ACA reports, the 1094C and the 1095C. But before we jump straight into the product, I wanted to highlight that benefits and the ACA functionality is part of Workday's one unified human capital management solution. As such, Workday for ACA has access to all the necessary data that it needs: core HR data, time tracking, payroll, and benefits data, all of which interact in a single code line. Having all of this data within Workday allows us to analyze, report, and manage all aspects of ACA, from eligibility to automatic enrollment, so that you can stay in compliance with the evolving requirements of this regulation. So let's go ahead and take a look at the first item on our agenda, Workday's configurable ACA dashboard. So I've logged in here as Logan McNeil and navigated to my Affordable Care Act dashboard. Delivered in Workday 21, this is our first step to help our customers identify who is eligible for ACA. And on the dashboard, you can see we've delivered 2 reports that highlight areas of liability for you. The first report here is our ACA qualified employees enrollment count. And it shows us full-time employees who are not enrolled in medical insurance and should have healthcare coverage under the Affordable Care Act. And as you know, within Workday, all of our reports are actionable. So we can see currently there's a total of 167 employees. However, 8 of those employees, or 5% of them, do not have healthcare coverage. And we can drill down into the details there. We can look at it by different dimension or view the details if we wanted to do so. On the right-hand side is the second delivered report. And this one is showing us part-time employees that are working more than the federal full-time standard threshold, which is currently set at 30 hours per week. And what we see here by organization are our part-time employees that is actually working more than that federal full-time standard. And so, for example, if we take a look at our sales and marketing organization, we can once again drill into that, look at this by different dimension, or just go ahead and view the details if we wanted to. And when we do so, Workday will show us each of those employees that is working more than that average 30 hours threshold. And so we can see here that we have Joy Sandoval, we can see some job details about her, and notice that her scheduled hours is 20 hours per week, but that her average weekly paid hours is over 79. And so clearly she's falling above that threshold. And so right from here, I can take action. You know, right from here, I can see who Joyce is, I can see who she is, what she does, and if I wanted to view more details about her benefits or any other area, I could go ahead and do so. Now, when Workday designed the ACA features as well as this ACA dashboard, we realized that legislation and requirements could change. As such, we've designed the ACA functionality to be configurable, allowing us and our customers to quickly adapt to future requirement changes. So let's take a look at how you can go ahead and configure this dashboard. To do that, I'm going to search for my task, my Affordable Care Reporting Configuration task. And so this task is where we'll define the various elements that drive our ACA dashboard reporting as well as some ACA settings. The first section here is our worker population, and this is where we define what population to include for our Affordable Care Act reporting. Next, we have our look-back dates. Now, these dates pertain to the reports on the dashboard that we were just looking at, and they're not used for the measurement period. We'll take a look at measurement periods in just a few minutes. Down below, we have our hours source. So here we identify, are we using Workday payroll hours, or are we using third-party payroll interface hours from a different payroll system? And on the right-hand side, we can see the average threshold for the paid hours standard full-time status. So we can see currently it's set at 30 hours per week or 130 hours per month. And if I scroll down a little bit more, you can see where we've defined the federal poverty levels. And notice that all the fields we've been looking at, they're all editable. And so when the IRS updates or changes any of these values, such as the poverty levels, you can come in here and quickly review and update the levels as required. So we've taken a very brief look at Workday's delivered ACA dashboard and the configuration options. Next, let's take a look at how Workday helps you manage measurement periods and automatic enrollment. So a measurement period is the length of time in which a part-time variable hour employee is measured to determine if he or she has exceeded the 30 hours per week average threshold. And in the feature we designed, we first take a look at our variable hour part-time employees and their average hours worked during the specified measurement period. Next, we identify if they qualify as full-time based on the ACA measurement period, and we set a flag. And then finally, we will use that flag and apply it to our eligibility rules, which passive events will process and react to eligibility changes and automatically trigger enrollment events to offer or terminate healthcare coverage as applicable. And the key thing to note here is that Workday automates this. Workday can automatically generate enrollment events for qualified employees, as well as detect and end an employee's enrollment if that employee reaches the end of a measurement period and is no longer full-time. This really sets us apart from other point solutions, as we have all the data we need to determine eligibility, and we can automate this process. There's no manual intervention required and relieves a lot of burden that's placed on administrators. So let's jump into the Workday product and take a look at how you would set up measurement periods within Workday. I'm going to go ahead and just search for my measurement period task. I can go ahead and create one, but we're just going to edit an existing one that I've already set up. And we're going to edit the one for the 2014 to 15 measurement period. Now keep in mind, the key goal of a measurement period is to identify your variable hour part-time employees that qualify as full-time according to the federal full-time standard, and then set the ACA full-time flag, which we will use in our eligibility rules. And within this measurement period task is where we tell Workday how far back to look to determine if those variable hour part-time employees have exceeded the 30 hours per week threshold. So let's take a look at the details of this particular task. So we have our name, and the next thing to look at is our measurement period eligibility rule. Now this is the rule that will identify those variable hour part-time employees that could be eligible for healthcare coverage. In other words, this is the population of workers that we need to test and measure the actual average number of hours worked for a given period of time. And if they do exceed that threshold, we then need to offer them healthcare. Next, we define our ongoing measurement period. So within this ongoing measurement period section is where we tell Workday what our measurement period start and end date is. In other words, the date range where we take a look at an employee's average hours worked to determine if they are eligible for healthcare coverage. And so in my example, my duration here is 12 months, with my start date beginning on October 15th, 2014, and ending on October 14th, 2015, which aligns nicely with open enrollment. The next field here is my administrative period, and this dictates how much time an employer has to notify and enroll those variable hour part-time employees in healthcare coverage. And then finally is our stability period. And so that is the amount of time that an employee can continue their coverage. And in my example here, it is 12 months with coverage beginning on January 1st, 2016 and ending at the end of December 2016. So in my example of this ongoing measurement period here, if a variable hour part-time employee has averaged 30 hours or more between October 2014 and October 2015, they will be eligible for coverage for the entire year of 2016, regardless of how many hours they worked during 2016 and as long as they are still employed. Next is the new hire measurement period, which will start on the new employee's hire date. And so Workday has, with this new hire measurement period, Workday has provided a tool to provide more visibility into for our customers to see the measurement period for new hires. And remember, an employee who has completed one measurement period is considered an ongoing employee. A new hire who is still within the initial period is not considered ongoing. So let's take a look at this tool, this new hire period tester that we provided. I know that I have a new employee called Kerry Marks. I can put in her name, use my related actions. I can see she's only been here for 4 months and 30 days. And then I can put in the details of my measurement period. Let's say 12 months is my duration and my admin period is 3 days. I'm going to go ahead and click on OK. Now Workday is providing me full visibility into the new hire measurement period details for that new hire. Okay, great. So once we set up our measurement period, the next thing we'll do is set up our enrollment and passive event rules. And then Workday will automatically either generate an enrollment or termination event if an employee's eligibility has changed. So once again, There's no manual intervention required. Workday is going to automate this for you. And even though this is happening behind the scenes, you'll still have full visibility into the measurement period history of your employees. And so let's take a look at one of my employees, Annie Bin. If I use my related action, I can come to benefits section. I can scroll down to my ACA measurement history. And I can see for Annie, when I look down below, I can see her look back history. And so for the 2013 measurement period, we can see that she did not qualify as a full-time employee under the ACA measurement period setting. And that's because her average hours worked was under 30 hours. So she worked an average of 24.91. However, in the 2014 measurement period, she did qualify, and as we can see here, her average hours worked was 41.47, so above that threshold of 30 hours per week. And we can see the period in the number of months in our period, which is 12 months. And when we drill down into that number, we can see the actual payroll hours. Whether it's from Workday payroll or payroll interface, you have full visibility into those actual payroll hours within the Workday product. Okay, so we've taken a brief look at our ACA dashboard and the configuration options. We looked at our measurement periods and how we can automate enrollment events within Workday. Finally, let's take a look at the last item on our agenda, the 1094C and 1095C reporting feature, designed to help our customers comply with the Affordable Care Act's reporting requirements. And so with this feature, you'll be able to specify several options on the 1094C form by company, and specifically by companies with employer identification numbers. You can choose exactly the employee populations you'd like to apply Section 4988 safe harbors. And we also have a new task where employees can specify how they would like to receive their 1095C forms, either electronically or both electronically and in print. And then Workday will generate all of the data for both the 1094C and 1095C forms, while still allowing you to review that data and export it. And that will be available through the related actions within Workday, and Workday will also transmit that data to the IRS. So let's jump into the Workday product and take a look at how you would configure the 1094C company configuration. I'm back into the Workday product, and I'll just type 1094C. And what I'm going to do is go ahead and edit my company configuration that I've already set up. And let me open that up. So the first thing you do when you set up your company configuration is you specify the year and you specify it for the company. And the IRS makes it clear that each company must report by EIN, so you need to have your employee identification numbers in Workday. Next, we enter the name and phone number of the contact person. These are text fields allowing you to enter the data exactly the way that it needs to appear on the form. In Part 2 here is where you'll specify if the company qualifies for any of the certifications of eligibility specified on line 22 of the actual form. The selection a customer makes here will really depend upon their circumstances, and this is where PwC will be able to provide you with some guidance on what to choose. And then down below in Part 3 is where you will specify your minimum essential coverage offer by month. And so we can see in column A here, you specify either your minimum essential coverage offer for all 12 months, or you could do it for individual months. In Group D, you'll specify if the company is part of an aggregated ALE group. And so in my example, we can see that this company is indeed part of the 2015 ALE group. And I can pop this open in a different window to just see what that looks like. And here we can see companies that is part of that ALE group. And then finally, in column E, is the 4988 transition relief indicator. And it will show either an A or an B if transition relief has been selected in section 2 above here. So currently at the moment, it's indicating a B, and that's because we've selected that particular option under Part 2. Where I select another option here, you'll notice that it'll display an A as well. Once again, this is a great area where PwC can provide you with some support and guidance. So once we set up our 1094C company configuration, we will also set up our ALE groups, and we'll configure the 4988 safe harbors. Once all of that is done, we can actually get to the good stuff, and we can create the data and the forms. Let me cancel out of this, and let's go ahead and create the data that we need for the 1094C form. So I'm going to go ahead and tap in my task, create ACA. Here we can see it's our task, create ACA 1095 and 1094C data. I select this task, and I start off by specifying the year that I want to do this for. So let's say 2015, the company I want to do it for. Then I can schedule to run this in the future, or I can just go ahead and run it now, which is what I'm going to do. And then Workday will take you to this task where it'll run the batch process that's actually going to go ahead and create the data that we need for the 1094C and the 1095C. And it gives us a great processing time and completion. And we'll see down below, it specifies by company, it shows us the company FEIN number, and it also shows us the number of 1095Cs processed, which is currently 192. And we'll just refresh it once more, and there we can see this task is completed. And so now Workday has generated the data for both the 1094C and 1095C forms that you need. Then the next thing you want to do is view that data that we've just created. And so once again, Workday has provided you with some tasks to go ahead and view the data. And so here we can see we can view our 1095C as well as our 1094C form data. We're going to take a look at the 1095C data at the moment. And I can go ahead and view this by year or by company. And I can also even look at it for individual workers. Let's just run this and just take a look at it for the company. Now when I run this task, Workday provides you with this report. We can see for all of your workers that's eligible for the ACA, we can see their details along with all the data that we need to submit the 1095C form. And I can scroll to the right to see more data. And of course, you can export this to Excel to review and work with this data in Excel. And it's important to note that you can create this data as many times as you like to get it right. It'll just override previously created data. And you can view the 1094C data with using that similar task that we just saw. So now that we've created the data, we have visibility into the actual data, the next and the final thing to do is to actually create the forms that we need. And so to go ahead and do that, I'm going to use my task, create 1095C forms. And once again, I can create this form by year and by company. I can also do it for individual workers if I want to. I'm going to choose to create it for all of my workers, even those that have opted out of the paper copies. And click on OK. And then Workday will run a batch process once again with some processing time, and it'll now go ahead and create all of those 1095C data forms that I need. And keep in mind that since we're creating the 1095C forms now, but keep in mind, since the 1094C will be sent to the IRS electronically, Workday will not generate a printed copy. However, you can view all of the data that will be transmitted via that task I showed you a little bit earlier. Let's just go ahead and refresh this. And there we can see this task is completed, and Workday has generated all the 1095C forms for us. Let's go ahead and look and see what that looks like. Open that up. And then we can see for each employee, we generated the 1095C. We can see the name of the employee, Carol Abbott here, and then we can see how Workday has completed the details of this particular form. And then I can scroll down and look at the other employees that we've generated this event for as well. Now, forms will only be generated for employees that have elected to receive a printed copy. employees that have elected to receive an electronic copy can access this via related action. So if we take a look at Carol, for example, and we use our related action here, we come into benefits. Down below, we can see where we can see her printing elections for her 1095C, where we would view the forms as well as the measurement history. Let's go ahead and click on View the Forms. And there we can see this is how Carol would access her 1095C form. She can click on View or Print and then see the exact same form that we just looked at. So what we've just seen is how to specify the 1094C company configuration and how you can easily create the data and forms for the 1094C and 1095C reports, and then either access those through related actions or deliver printed copies, as well as then transmit that data to the IRS. And so, in summary, the features we deliver are very comprehensive, and they provide a lot of flexibility to support the evolving ACA regulations. They will allow you to analyze, report, and manage all aspects of ACA, from eligibility to automatic enrollment to creating and transmitting the required data to the IRS. And Workday will continue to monitor the ACA regulations and will enhance or add features in any upcoming releases to help you stay in compliance. And with that, I'll hand it back over to Charlie.
Thank you, Marlene. I appreciate that. Let me just kind of, there we go. Just give me one moment while we navigate to the next slide here. There we go. So how can PwC help in this? And in general, we can help most clients going from strategy and the assessment through design, construction, implementation, operation, and review. And of course, project management and change management are really important elements here, since this is a new area for employees, and they're very often going to be confused by what's going to be going on. One thing I just want to emphasize on this slide is we can do this either end-to-end or kind of a la carte. We know that employers are at different points in preparing for ACA reporting, and that's why PwC generally meets with the clients where they are kind of on their ACA compliance journey. Some companies have done more in the data diagnostic area, some on the strategy, some on the actual form preparation, and so on. But whether you need help augmenting the current efforts or developing a full plan around the ACA compliance and reporting, we can basically help with those elements. Using our ACA diagnostic, which we do as a first step, and I'm going to spend a moment on this on the next slide, we help clients identify the technical and the organizational issues that will need to be addressed. We collaborate closely with our clients to develop a strategy to address and tackle all of those challenges. We leverage the Workday technology, which, as you just saw, is a very, very powerful tool, along with other tools such as PwC's Data Information Center, to deliver the solutions that are needed to basically lighten your burden with this effort and also add efficiency and security to make sure that your ACA reporting requirements are accomplished successfully. So employers often ask, where do I begin? And I think the best starting point is generally a diagnostic or a gap analysis that can level set what you need to do, what your particular challenges happen to be, and give you a path to lead to development of a strategy and a roadmap for successful implementation. So step one, kind of the upper left icon here in this diagram, looks at where you are at, what has already been done. So that's a large portion of the beginning point of the diagnostic. Another significant area relates to obviously identifying some of the gaps that are out there. For example, what gaps exist in relation to the data? both aggregating the data from the various sources, which can and will be a challenge, and then what are the potential issues with the quality of the data and inconsistencies that are out there. This is an area that we work with employers extensively, and bad data at the end of the day can basically ruin the project and throw things off. The other areas reflect the challenges that we've discussed, but we try and go through and address them in a more comprehensive, holistic way when we're doing the data diagnostic and the strategy portion. So for example, identifying who the full-time employees are, looking at minimum value and affordability, addressing the waiting periods, tracking employee movement, and so on. So we've talked for a long time about preparing to do the report, and Marlene just kind of showed us some of the technology that's out there for the report being generated through Workday. But before I wanted to close, I wanted to kind of talk about getting the information onto the IRS forms, for example, using Workday that happens to be out there. One thing that is important is, as Marlene was indicating, is making sure their forms are reviewed, that they're correct when they're filed, there are penalties for incorrect information that's being filed, and having a team member who has experience working with IRS filings and potential IRS penalties. So PwC, some of the things that we do is we work very seamlessly with the data transfer between Workday and our information reporting and delivery center. We are out there, we generate millions of tax returns and tax forms every year. We have an onshore, not offshore, an onshore delivery center that we use for situations such as this. And we have specialists who basically work with examinations, should that come up from the IRS, and to help try and mitigate or reduce the possible chance of an IRS examination. We also have an onshore call center, can support employee questions that are coming in, and last but definitely not least, very deep subject matter experts that can help work with you in resolving questions related to your ACA compliance. And I'm just going to touch basically on why PwC and Workday. And just from the PwC side, and I'll hand it back over to my Workday colleagues, this is very largely a tax exercise, and we're, to be blunt about it, we're one of the top tax firms in the world. We have outstanding staff who work exclusively on Workday projects and bring their project management, system implementation, and data analytics experience to bear. And couple that with our form preparation ability and the ability to help with employee inquiries and potential IRS appeals. We're able to come at it very much as a holistic partner to help you in fulfilling any ACA reporting requirements and also in implementing the Workday ACA solution.
Thank you, Charlie. And I'd just like to add, as hopefully you've all seen, both Workday and PwC have made a significant investment in making sure that we build the expertise to help our customers be compliant with these requirements. And really this combining the Workday solution with PwC's guidance and services, we really feel will help our customers to navigate these complex requirements. So we don't have very much time, but I would like to at least maybe answer one or two questions. We have Mark Hines, our Workday Benefits Product Manager, also on the line to help answer any questions. So I'm going to start with one question we have here. We have 6 entities, but all wages are reported through a single payroll services FEIN. Will we need to submit 6 different 1094-C and 1095-C forms, one for each entity, or one set for the single payroll services FEIN number?
I think the answer to this question is yes, but Charlie, you can back me up on this if you know anything more than I do.
Yeah, unfortunately, it would be yes. That's one of the difficulties associated with how they structured the rules. So, but there's advantages to actually breaking it out. So the penalties that I talked about earlier, the $2,000 per employee across your entire workforce, that gets done per ALE. So the example I gave earlier with 1,000 employees, if you had 10 FEINs with 100 each, instead of paying $2 million, you'd be paying $200,000. So even though it's more burdensome from a reporting side, it will help mitigate and minimize some of the penalties.
Great. I think we have time for one more question. We offer medical coverage to employees that are part-time, working at least 25 hours a week at part-time rates. With the ACA ruling states, if working 30 hours or more, they are full-time, they need to be offered full-time benefits. Is that ruling for companies that do not offer benefits to part-time employees?
Yeah, and unfortunately, the way the rules work, it's not how you categorize the employees. The government has come up with its own definition of full-time, and if you're working 30 hours or more, you will be treated as a full-time employee, even though you may designate them as part-time. So in that situation, if you have all your employees work 30 hours or more, but you designate them as part-time, those employees will have to either be covered or you'll have to make sure you're satisfying one of the tests. But there's definitely a penalty potential there.
Okay. So unfortunately, we're at the top of the hour. We have a lot of information to share, so I apologize that we didn't have as much time for questions. But and I realized there was some issue with the audio, so we'd like you all to know that we will send a full replay with the audio. You'll be emailed a full replay. So just so you know that you can come back and listen to it. So I'd like to thank Charlie and Marlene and Mark for joining me today, and I'd like to thank all of you for taking time out of your day to join us to hear about what PwC and Workday are doing to help you navigate the reporting requirements for the Affordable Care Act. So thank you very much and have a great workday.
Ladies and gentlemen, that will conclude your conference call for today. Thank you for your participation and for using AT&T Executive Teleconference Service. You may now disconnect.